Attention deficit hyperactivity disorder is a common disorder affecting approximately 1 in 20 children and follows about 65% of individuals into adulthood. However, ADHD is often misunderstood and misdiagnosed. The 4th South African Multidisciplinary ADHD Congress was held from Thursday to Saturday, hosted by Stellenbosch Business School. The Goldilocks and Bear Foundation partnered with them, and experts presented the latest research. Let's chat now to Professor Renata Schoeman from the Stellenbosch Business School. She's the head of health leadership. Prof, a pleasure to have you on the program this afternoon. Can you firstly start by giving our viewers a brief overview of the current state of ADHD awareness and diagnosis in Southern Africa?
Over the past couple of years, I would say maybe about 7-8 years, there has been really an improved awareness, supported by media work that we've partnered with, but also very concerted efforts from our side in terms of educating communities, educating healthcare providers in terms of ADHD. However, ADHD is the most prevalent psychiatric condition amongst children, with about 5% of children affected, and adults also struggle with ADHD, although some of the children seem to outgrow ADHD. Yet there's significant barriers to care in South Africa, specifically due to lack of awareness, lack of access to services, and then also with regard to funding.
What would you say are some of the common misconceptions about ADHD that you've come across in your research and the work that you've done in this field?
So the first one is the stereotypical picture of someone with ADHD being a naughty, boisterous boy, and then the associated ideas that people with ADHD are lazy or stupid or just need better parenting or just need to pull themselves together, when in fact it's a neurodevelopmental disorder with clear scientific evidence for the brain functioning differently and which can be very successfully treated. The second part when we talk about treatment is that people think medication are dangerous and addictive, but if it's prescribed, it is extremely effective, but there should be close supervision and monitoring. Yet we also need to look at a holistic approach where we also focus on psychoeducational interventions, workplace support, and also lifestyle interventions. Medication can definitely not stand on its own.
Right. So how does the lack of knowledge about ADHD indeed impact individuals who may be struggling with it but have not been properly diagnosed?
So when we have undiagnosed ADHD, it can really have dire consequences. One of the first things is a poor self-esteem, because life is just more difficult than it should be, and you struggle to complete tasks which others might do in their stride. So we often then see comorbid conditions such as anxiety disorders, depression, substance abuse, but then also more significantly, especially in the South African context, where we see dropout out of school or up to 2 years lesser educational attainment. And then once someone is an adult, we see frequent job hopping, we see difficulty in interpersonal relationships or marital relationships, and all the complications associated with that. Yet, with sufficient treatment and optimal management, a child and an adult with ADHD can really flourish and perform according to their potential.
Could you elaborate a bit further on the key challenges and barriers to a proper ADHD diagnosis in the Southern African context here?
The number one, as we mentioned, is lack of awareness. People do not even know that, or they might have misconceptions in terms of poor parenting, as I mentioned, or children just being marked as or labeled as slow or lazy or whatever the case might be. But then in the South African context specifically, we've done a study 2 years ago which looked at stigma. And stigma is a massive concern for all mental health disorders, but also specifically in ADHD, as communities often blame the parent or specifically also the mother for the problems that a child might experience. And parents are then often also hesitant to take their child for screening or evaluation for a mental health disorder or a neurodevelopmental disorder such as ADHD because they're scared of the label. However, we do not consider diagnosis a label. We consider diagnosis unlocking support structures that can be put in place for an individual. And the second thing that we said in terms of lack of awareness and then the stigma is then also lack of access to care. There's a dire lack of resources in South Africa, where we are running in Africa at around about half a psychiatrist per 100,000 of the population, where in Europe there's 9 psychiatrists per 100,000 of the population. And although South Africa have a decent healthcare budget, which is roughly 13.8% of the GDP, only 5% is allocated to mental health, and of that, only 1% to child and adolescent mental health services. So we just do not have the resources in terms of manpower, but also in terms of funding.
Now, in your opinion, how does the stigma associated with ADHD affect individuals' willingness to seek help or even discuss their experiences openly?
It has a significant negative impact, as I mentioned. So there is direct stigma, but then there is also stigma by association. So me as a mother might not necessarily want to access care because if my child are being diagnosed, I'm being seen as a bad mother, for example. But we also know that ADHD is highly genetic. So up to 80% of individuals with ADHD have a parent or a sibling with ADHD, which makes parenting then even more difficult. And then it's also relatively costly to treat. People often think medication is the expensive part, but that's part of the direct cost. And our studies clearly have shown that medication only is about 7% of the cost of ADHD. The indirect cost, like absence from school or work, comorbid conditions such as anxiety, depression, or substance use, and also what we call the intangible cost of ADHD, the impact that it has on your quality of life, is very costly.
And are there any specific initiatives or even strategies that have been successful in raising awareness about ADHD and also improving diagnosis rates in South Africa?
Yes. So other than the work that the South African Society of Psychiatrists Special Interest Group for ADHD has been doing over the past couple of years, also, for example, in writing guidelines for the management of ADHD, we also have the Goldilocks and the Bear Foundation, which is predominantly active in the Western Cape, but the goal is to expand nationally. We're really focusing on raising awareness and also help with screening of children in underprivileged areas, and we screen for mental health barriers. So anything that can present in a child with academic, behavioral, emotional difficulties, that children can be referred to the foundation for a thorough evaluation and assessment, and to provide them with free support from a volunteer network of occupational therapists, psychologists, and also psychiatrists, teachers, everyone that gets together and to provide the services for these children completely free of charge. And we're really collaborating with the Department of Health and Department of Education. And in this way, we really strive to develop resilient, resourceful children.
So from a policy and funding perspective, what steps do you believe are necessary to also address these gaps in ADHD diagnosis as well as treatment in the region?
So there's a few things. I think media and platforms like even the interview tonight is so important to really spread the word. But secondly, we need to do community interventions as well in terms of education. And it's not only about ADHD, but really to provide parental guidance, to upskill educators and all healthcare providers. And that's also where the Southern African Multidisciplinary ADHD Congress comes in. We're actually still busy with it. We're only closing 7 o'clock tonight. And we have more than 450 healthcare professionals and educators attending, with more than 40 speakers from different countries. And this is really helping to equip people also to recognize in children. So that is the awareness and education drive. But definitely policymakers, both in the public sector but also in the private sector, needs to listen up. And there should be reforms. For example, considering ADHD a prescribed minimum benefit condition, and then also for pharmaceutical companies and government to look at better tender processing and making medication more accessible and affordable both in the public and in the private sector.
Let's chat a bit more and get your insights of the 4th Southern African Multidisciplinary ADHD Congress. What are some of the topics or discussions that are set to be covered as well?
So we had, as I mentioned, we had 40 sessions, 40 speakers, 11 countries being present. I think there were some of the sessions that stood out for me. Obviously, it's always into the new developments in terms of the management, but also there was an excellent talk by Professor Jan Buitelaar from the Netherlands, which focused on the positive aspects, on the resilience of a child. So it's protective factors. I think we often look at the negative things and what is risk factors for condition, but can't we change the conversation in terms of protective factors for the development of a mental health disorder? Also brilliant talks by, I think, Professor Sven Bolser. He is also from abroad, and he spoke about not only diagnosing in terms of criteria, but diagnosing in terms of the functioning of a patient. So a way more holistic view. And then we just came out of a session in terms of new developments, in terms of herbal and fungal strategies for the management of ADHD, whether there's evidence, whether there's not evidence, etc. But there was also brilliant talks in terms of the education system, concessions that students and children can get, workplace accommodations, and also a talk by Mr. Henk Arantjes from one of the primary schools in the Western Cape, which has a complete inclusive school that really developed their approach in the curriculum also to accommodate children with that's not neurotypical, neurodiverse.
Yeah. So how can healthcare professionals, I mean educators, as well as parents work together to create a more supportive environment for individuals who are living with ADHD?
First thing, and that's more from my clinical experience as well, parents and teachers don't talk enough. Parents are not involved enough. I don't say you must be a helicopter parent, but at least reach out to the teacher to get feedback on your child's progress. But also teachers can write little notes for the parents and check the books if there is a reason that you need to discuss. Upskill yourself, follow organizations, for example, the Goldilocks and the Bear Foundation's Facebook page where you can get relevant information. There's also a book that we wrote, All of These Things Are Important to Me, which is a brilliant resource for both teachers and parents in terms of the management and identification of a child with ADHD. But that is definitely the conversation that needs to be held. And also that you can have access and up-to-date information in terms of initiatives like the Congress, and register for next year's Congress. You're too late for this year. But next year's Congress, we will bring again updates, knowledge to educators and healthcare professionals.
As we wrap up our discussion, Prof, what advice would you offer to individuals who suspect they or their loved ones may have ADHD but are unsure about seeking a diagnosis or even treatment?
I think what is very important, if there's a concern, discuss. So talk to the teacher and do go and see a professional. We do not diagnose ADHD as a tick box exercise or something that you can diagnose from a TikTok video or an online checklist. This is not it. You need to consult preferably a psychiatrist or a clinical psychologist, but a good place to start might even be a general practitioner or an occupational therapist that can help you to access the correct person to evaluate your child. It's a comprehensive assessment, but we know that the benefits of treating for the trajectory of the patient's life, whether you late diagnosed as an adult or young diagnosed as a child, the outcome is so satisfying and you can really have a brilliant life. It's not a punishment to have ADHD.
That was Professor Renate Schoeman, the head of healthcare leadership at the Stellenbosch Business School, giving us a sense there about that conference currently taking place.